Hi, good evening everybody. I'd like to thank you guys first off for allowing me to come speak with you guys, Seward Volunteer Department, Fire Department, about a subject that has implications with both fire, medical, and police. And that's going to be, we're going to be talking about subjects who are dealing with excited delirium. I want to start off by showing you guys a quick video.
I'm gonna grab my balls. When I grab my balls one last time, it's okay. I can hear this one. It's weird. Even though I'm okay, I'm gonna grab my balls. Not okay though.
Yeah, we gotta get you to the hospital.
Isn't that okay? Please, anti-tap my hand. Please, anti-tap my hand. Please, anti-tap my hand. Please, anti-tap my hand.
No, it's okay.
Please,
don't fight.
Please, anti-tap my hand. I fought. Please, anti-tap my hand. I fought. Please, let I thought.
We're gonna get you to the hospital.
Please, and I taught.
Relax.
Please, and last time I shook and I taught my. Please, please. And last time I grabbed my balls and I shook. Please, and last time I grabbed my balls and I shook. Please, and last time I balls and I shook. Please, and last time I grabbed my balls and I shook. Please, and last time I shook and I grabbed my balls. Please, and last time I shook and I grabbed my balls. Please, and last time I shook and I grabbed my balls and I shook. Please, and last time I shook and I grabbed my balls and I.
Yeah, that's fine.
No, I'm serious. No, I'm serious.
Like I said,
No, I'm serious.
It's okay.
I'm serious. I'm fucking serious. No, I love you, Enzo.
It's okay.
All right, so the good news is the guy in this video, he survived. The reason he survived was this is one of the few fire departments and few towns where the police and the fire have training about excited delirium, and they work together and they use an integrated approach. What you can't see in the video is there's about 4 cops and about 5 EMTs who are holding him down, got him all strapped in. So all too often, unfortunately though, there's not a lot of training about excited delirium, and all too often excited delirium ends up as in-custody deaths. Excited delirium was first described in the mid-1800s. Since then it's gone by several different names. Bell's mania, lethal catatonia, acute exhaustive mania, and agitated delirium. Regardless of what we call it, the sequence of events is always the same. There is a violent agitation and paranoia, which follows a sudden stop of all struggling, then breathing stops and the patient dies. The reason this is so important for us as first responders is the subject exhibiting any signs of an excited delirium is very dangerous, not only to themselves but to you as first responders. These subjects, like I mentioned, are delusional, they are combative, and they have little to no response to pain. By understanding what excited delirium is, recognizing symptoms of excited delirium, and knowing what you as first responders need to do when you suspect excited delirium is present, you can take actions to better help your patient while protecting yourself. First and foremost, we as first responders need to recognize and realize that excited delirium patients are actually psychiatric patients who need immediate medical attention. Excited delirium is a disorder that affects the transmission or the transportation of dopamine inside the brain. Most often, excited delirium is brought on by heavy central nervous system stimulant use, such as methamphetamine, cocaine, and PCP. But it's important to know that not all excited delirium cases are brought on by drugs. The Mental Health Daily newsletter explains that in excited delirium, the brain's ability to reuptake dopamine malfunctions. So what happens is the brain has an abundance of dopamine that resides inside the synaptic clefts inside the lobes of the brain, and this excess dopamine causes the heart rate to rise, the breathing to quicken, and the patient to exhibit hyperthermia. Eventually, the cardiovascular system cannot support itself under the increases, and so the cardiovascular system collapses and the patient suffers from a sudden cardiac arrest. One of the main difficulties with excited delirium is it's hard to tell whether somebody's actually having excited delirium or whether or not they're just under the influence of a stimulant, because a lot of times they do act similar. I mean, this video that we just watched, you could say that guy was just high on methamphetamine. The Western Journal of Emergency Medicine says that the presentation of excited delirium starts off with a sudden onset, with symptoms of bizarre and or aggressive behavior, shouting, paranoia, panic, violence towards others, unexpected physical strength, and hyperthermia. One of the key indicators of excited delirium is that hyperthermia. As you guys saw in the video, the guy was completely naked. At the beginning of the video, which we didn't show, they showed up and he was running around with a knife in his house completely nude. So the average excited delirium subject has a core temperature of about 105 degrees. Their temperature just spikes through the roof. So these subjects will disrobe themselves, and usually, as first responders, you'll hear about this the first time as you're en route, because they'll be dispatched in as either a partially or fully nude person who's acting erratic. In addition, like I mentioned several times already, the excited delirium subjects are delusional. And there have been cases where these subjects have attacked firefighters and police because they thought they were monsters or aliens. There's even been extreme cases of people who are suffering from excited delirium where they've disemboweled themselves trying to pull perceived foreign objects out of their stomachs. What does this mean as first responders? This means that they're very dangerous. They're very likely to attack you. And if they do attack you, it's going to be very violent. The best way, excited delirium subjects also, like I mentioned earlier, they have almost superhuman strength and they're impervious to pain. This presents a quandary for law enforcement because lower levels of force do not work with these people. In other words, control techniques, pressure points, taser, and pepper spray, they'll have no effect on somebody who's in the middle of a true case of excited delirium. The best way that I have seen just by studying these cases is the only way to take care of them is manpower. You just need to have a lot of people to get on top of them. But as dangerous as these subjects are, we still need to remember that they need immediate medical attention to prevent that cardiovascular collapse that will happen if they don't get that help. The first rule of dealing with a patient with excited delirium is the same as everything else in the medical field. We need to take care of ourselves and take care of our people first. So that being said, the first thing that you need to do if you suspect excited delirium is get law enforcement on the way. Chances are they'll probably already be there, but this is something that your officers and whoever's in that right-hand seat needs to be thinking about. Police are trained in how to deal with combative subjects. As you guys all well know, here in Seward, if you call for police, you will probably get one officer. And I know that we all want to jump in and help, but it's important that you listen to and follow the commands of the law enforcement officer. If the contact turns into a ground fight and then a medic who is completely well-meaning jumps into the fray to try to help out, the officer might not know what's going on and the medic might end up getting punched in the face for his troubles. So I say that to say that the officer may ask for, and in some cases, depending on how bad the patient is, may probably ask for assistance. If this is the case, just do what the officer says and don't go any further. And if there's any question as to what you should be doing or not be doing, you need to verify with the police officer before you take action. So the first step is going to be to secure them. Handcuff them, strap them down. Once that's done, then the medics step in. Medics will treat their symptoms as their training dictates. This could include IV medication, or at the very least, just working on that hyperthermia, trying to cool the body back down. But one of the important things is while we're treating them, the firefighters, the police, everybody on scene needs to be extremely vigilant when looking at this person to monitor for changes in their breathing or changes in their mental status. Too many in-custody deaths could have been prevented had somebody paid attention and noticed that when the person stopped fighting, it wasn't because they gave up, it was because they stopped breathing. So when we're dealing with somebody with excited delirium, we need to be ready to start CPR at a moment's notice, and we need to have an AED on standby and be ready to administer any other basic life-saving procedures that we might think. Then finally, and probably most important for the patient, is we need to get them to the hospital as quick as possible. This is a patient who needs a higher level of training or higher level of care than what we can provide out in the field. Excited delirium subjects present a very tense and dangerous type of patient. Excited delirium is very dangerous also for the patient itself, just because it's difficult to diagnose and pick up. By talking about the causes of excited delirium, by discussing the symptoms of excited delirium, and going over the steps that we as first responders can take when we suspect excited delirium, I hope we as emergency responders can work together as an integrated team to get these subjects the medical treatment they need. Because while excited delirium is dangerous, it doesn't have to be a death sentence. Thank you.